In this session of GPAT KAKSHA, we will learn about antiadrenergic drugs or sympatholytics. In this, we will first learn about alpha adrenergic blockers, means which acts as antagonist to alpha receptors are known as alpha adrenergic blockers. The first drug in this category is phenoxybenzamine. It is a non-selective alpha blocker. Non-selective alpha blocker means it do not act specifically at a particular subtype of alpha blocker. It acts at all types of alpha receptors. Means it do not act particularly at either alpha 1 or either alpha 2 receptor, but perhaps it acts both on alpha 1 as well as alpha 2 receptors. This drug phenoxybenzamine produces a cyclic intermediate ethylene, means upon getting administered into the body, spontaneously it produces a cyclic intermediate known as ethylene, which forms strong covalent bonds with the alpha receptors. Thus, it is irreversible antagonist at alpha receptors, means it irreversibly inhibits the alpha receptors by forming strong covalent bonds. It causes vasodilation and postural hypotension. Postural hypotension means the falling of blood pressure depending upon posture, means if the patient suddenly gets up in standing position, all of its blood get pooled into the lower parts of the body because they are dilated, and thus it leads to fall in blood pressure. So that fall in blood pressure is known as postural hypotension. So phenoxybenzamine causes vasodilation, and primarily venous vasodilation. Vasodilation of veins is more predominant than the vasodilation of arteries. So it causes vasodilation and postural hypotension. Phenoxybenzamine is lipid soluble and can cause CNS stimulation. Since this drug is lipid soluble, it can cross the CNS, the brain, and thus it can produce CNS stimulation or stimulation of brain. It is used in management of pheochromocytoma. Pheochromocytoma is a tumor of chromaffin cells of adrenal medulla. It is a tumor of chromaffin cells of adrenal medulla, which leads to excessive secretion of catecholamines and thus leads to enhanced effect of adrenergic system. So since it is alpha blocker, so it blocks the activity of alpha receptors. So it is used in management of pheochromocytoma, in which the excessive activity of adrenergic system is seen due to formation of tumor of chromaffin cells of adrenal medulla, which leads to excessive secretion of catecholamines. The second category of drugs is tolazolene and phentolamine. These are non-selective alpha blockers. Tolazolene is an imidazoline derivative, and phentolamine is a congener of tolazolene. Both of these drugs, tolazolene and phentolamine, are reversible antagonists at alpha receptors, means these drugs get bound to alpha receptors for a short period of time. These drugs also produces postural hypotension. These drugs are used in clonidine withdrawal, in Cheese reaction, and in pheochromocytoma. Clonidine is a drug which we have previously discussed, is alpha 2 blocker, and alpha 2 agonist, selective alpha 2 agonist, and thus clonidine is used in management of hypertension. So after a continuous administration of clonidine for a long period of time, when it is withdrawn, so it shows abrupt increase in blood pressure. That particular case is known as clonidine withdrawal symptom, in which abrupt hypertension is seen after withdrawal of clonidine therapy. So tolazolene and phentolamine are used in clonidine withdrawal symptom and in Cheese reaction. In Cheese reaction, the absence of certain enzymes which leads to degradation, means absence of monoamine oxidase which leads to degradation of tyramine containing foods is absent, and this tyramine leads to abrupt release of noradrenaline or produces enhanced adrenergic effects. So to control Cheese reaction, tolazolene and phentolamine is used. The third type of drug in this category is Yohimbine. It is selective alpha 2 blocker, means the role of alpha 2 receptors is to apply a brake on sympathetic system, means to limit the activity of sympathetic system. So these kinds of drugs which are selectively alpha 2 blocker removes the brake on sympathetic system and leads to enhanced activities of sympathetic system. The fourth category is prazosin, terazosin and doxazosin. These three drugs are selective alpha 1 blocker, means these drugs do not blocks alpha 2 receptor. These drugs are used as antihypertensive in management of hypertension. These drugs are used in Raynaud's disease and prostatic hypertrophy. Raynaud's disease is a condition in which the blood vessels on distal part of a body such as hand, wrist get contracted, and due to that narrowing of blood vessel or contraction of blood vessel, the blood is unable to reach the surface and of the body, and due to that inability of blood to reach the surface of the body, that particular area turns blue in color due to absence of blood. So this condition is known as Raynaud's disease, and prazosin, terazosin and doxazosin are used in treatment of Raynaud's disease and prostatic hypertrophy. Prostatic hypertrophy is a condition in which enlargement of prostate glands occur, which leads to difficulty in micturition. So these drugs are used in treatment of prostatic hypertrophy, or known as benign hypertrophy of prostate, means non-cancerous prostatic hypertrophy or non-cancerous enlargement of prostate glands which leads to difficulty in urination. So these drugs leads to smoothing of prostate muscles, and also these drugs facilitates micturition. The fifth category of drug is Tamsulosin. It selectively inhibits alpha-1A receptor which are present in bladder and prostate. Means alpha-1A receptors are selectively or predominantly present in bladder and prostate, whereas alpha-1B receptors are present on blood vessels. So Tamsulosin is selectively used as in treatment of benign hypertrophy of prostate, which we have already learnt. For practicing MCQs and to learn important one-liners, follow GPAT KAKSHA on Instagram. The link of same is given in description. Study well, keep yourself motivated, always keep smiling. Stay tuned for next topic, Antiadrenergic drugs part 2. Thanks a lot.